Well, good morning. It's been quite some time since we've been able to have live audience and get together. So thank you for coming and welcome. And to those online, thank you for attending as well. Today, I'm joined by my colleagues, Mayor Al McDonald from the City of North Bay, Dr. Carol Zimbalatti, Public Health Physician, Nancy Jacko, Chair of the Board of Health, and Shannon Mantha, who is the Executive Director of Clinical Services and Chief Nursing Officer. And last, but certainly not least, Andrea McLellan, Director of our COVID Immunization Strategy. So as we host today's press conference outside, I want to acknowledge the deep connection and relationship of Indigenous peoples to this land. The land creates safe places for learning and healing and promotes opportunities for intergenerational knowledge transfer and provides a connection to reconciliation. Over the past 8 months, we've continued to look at ways to ensure that everyone in our district who wants a COVID-19 vaccine has access to one. We have offered mass immunization clinics, pop-up clinics, and clinics with the support of our community partners such as EMS, primary care, and pharmacies, to name a few. The success of COVID-19 vaccine rollout is clear. As of yesterday at 3 p.m., 80% of individuals 12 and older have received at least their first dose, and 73% of individuals 12 and older are fully vaccinated. However, this doesn't mean our work is done. There are still people within our district who want the COVID-19 vaccine but face barriers accessing it. This means we must continue to adapt and create new opportunities for individuals to access the vaccine. And as part of this, I am pleased to announce the launch of our mobile vaccine clinic. This retrofitted City of North Bay bus will be traveling across our health unit district, offering COVID-19 vaccines to those who want them. The mobile vaccine clinic offers 6 clinical areas, 2 of which are fully accessible for individuals to be vaccinated. Obviously, we could not have done this alone. Thanks to the incredible work and support of the City of North Bay and Mayor Al McDonald, we are able to be truly mobile. Mayor Al and the City of North Bay have been tremendously supportive of public health from the beginning of the pandemic. Anytime we've asked for your assistance, without hesitation, you have lent a helping hand. All of us at the health unit are greatly appreciative for everything you and the city staff have done to help us throughout this entire pandemic and to help keep our communities well. So thank you. I also want to extend my gratitude to Andrea McLellan and Scott Thibodeau, who are the driving forces, pun intended, behind this. They have done a tremendous job with their staff to make this possible. We have seen the success of offering a mobile clinic in other health unit districts and look forward to hitting the road with our first clinic on August 31st. We will still be offering COVID-19 clinics and pop-up clinics throughout our district, and the mobile vaccine clinic is but another additional tool. So with that, I'll pass it over to Mayor Al for a few words.
Great, thanks very much, Jim. It is my great pleasure to be here and bring greetings on behalf of the City of North Bay, and very proud to stand here with the health unit that has done a tremendous job for us through the whole pandemic. It seems like a lifetime ago, but I remember the date. It was March 17th, 2020. We had a news conference at the City of North Bay, and we had all our community leaders there, including Dr. Chirico, and really that's the day the world shut down right across the globe and in the City of North Bay. And we vowed from that day that the #1 priority was going to be the protection and safety of our citizens, and we have never wavered. And something that we've been very proud of, and it's taken a whole community commitment and belief in keeping our community safe. In fact, most of the pandemic, we had the lowest COVID numbers per capita in the province. That was something we're very proud of. We're currently, the last time I looked was a couple days ago, we're still second in the province, the lowest. And I think that just speaks to not only the leadership here at the health unit and the City of North Bay and all our community partners, but the community itself, the citizens and the businesses that really bought in to the fact that we need to protect all our citizens, including those that are vulnerable, and especially those that were at a higher risk. It was great news that they developed this vaccine so quick. And you saw the response from our health unit. We had the clinic up and running almost as fast as we could get the vaccines. And as a matter of fact, in the early days, we were challenged with supply. And the response and those that wanted the vaccine, obviously there wasn't enough vaccine to go around. So it did create pressures in our community. But it's interesting, now it's reversed. So now we have the supply and we're seeing less demand. And as Dr. Chirico mentioned, we're 80% with over 80% with one dose and over 70% with second dose. And I've always stated from day one that our goal is 90%. And we know that we have to encourage those individuals that maybe are sitting on the fence, maybe have heard the scary news that isn't correct and the misinformation and the propaganda that's out there. We need to encourage all those citizens that the vaccine is their best friend. They need to get vaccinated. So the clinic worked extremely well at Memorial Gardens, and as the media probably heard and our community heard, the appreciation to all of those frontline workers at Memorial Gardens was off the charts. I've never seen a response from our community that they were so appreciative than that clinic. But everything runs its course. And now, as Dr. Chirico and Andrea will say, we have to go where everybody is. And that's what we need to do to get out and get to those that maybe aren't too sure, sitting on the fence, or have heard wrong information. We have to correct that information and get them vaccinated. So today is all about how we're going to get out and get to that 90% so that we don't get shut down. We don't have to go back into lockdown because of the fourth wave. And there's no question the Delta variant is already surging across the United States, and you're seeing cases surge in Ontario. And I believe our citizens, our health unit, our community partners will show a leadership role so that we don't run into that fourth wave here, that the vast majority of our citizens will be protected. So I'm going to stop there and I'm going to turn it back over to Dr. Chirico.
Thank you, Mayor Al, and I feel very comfortable now after listening to Mayor Al that I'm going to direct all the questions about public health to you because you have a firm grasp of what we're trying to do, and thank you so much for that. So that ends our remarks, and we'll start by taking questions first from the media and then online. And then when we're finished, we welcome the media to take a tour of the bus. We have, I believe that's Lara over there. And she's a public health nurse that'll take you through one at a time. So I'll get with the help of my colleagues. We'll begin answering any questions you might have.
Dr. Chirico, nice to see you.
Nice to see you again.
A lot of people say that the people that haven't been vaccinated are never going to get vaccinated. What's your message to those people to try to get through to them? You know, is it going to have to be, you know, policies from their employer that's going to have to make it work? What would your message be to those people?
That's an excellent point, an excellent question. I think that certainly there's going to be those that don't want to be vaccinated, but I think that others may be just hesitant to be vaccinated, and we're here to help answer questions that they may have. Please call the health unit and talk to us about the vaccinations. They're safe, they're effective, they've been proven really to help reduce severity of illness, help reduce hospitalizations and deaths. So we know it works, we know it's safe. And for those people, I think there's a vast majority of those that haven't been vaccinated. I think they're just hesitant and they just need more information and correct information. And so we're here to provide that to them. And I think that we're going to see an increase in vaccinations over the fall. I think that people were quite fatigued with all of COVID. It's been a long, long time. They wanted to enjoy their summer. Some people have voiced that they simply didn't want to have any of the side effects afterwards, which are hugely, the vast majority are mild, but I think that in the fall, especially with people going back with the kids going back to school and those that haven't been vaccinated or can't get vaccinated because they're less than 12, I think that people realize that, you know, we need to protect them, and the best way to protect people is to have less community spread. So I think we're going to see more and more people get vaccinated.
Good morning, I'm Mike Lee from the North Bay Nugget. Dr. Chirico, I'd like to ask just about the idea of vaccine passports and whether that's something that the health unit is considering.
Yes, that's an excellent point. It's very topical right now, and it certainly is controversial. But I am in support of a vaccine passport, but I do believe that in order for it to be effective and efficient, I believe that it needs to come from the province. I think that it should be a provincial initiative. In doing so, that will ensure that it is consistent and that it is coordinated and that it can be secure. And so I really do believe that it should be something that we adopt, but do it provincially.
Perhaps as a follow-up to that, where would you like to see a vaccine? Where would you like to see a vaccine passport extended to? What would that cover? Would that be restaurants, going to events, that type of thing?
Yeah, a lot of I think that it should be in areas that certainly aren't essential, and that I think that with that type of option, it provides an added level of care for the community and to help reduce the spread. So it would be in that group.
I have a couple more. If I heard you correctly, I believe you said that the mobile vaccine clinic will have its first clinic August 31st?
First, yes,
Okay.
yes.
Where will it be heading, and then where will it go after that?
Yeah, it'll be in Sturgeon Falls at Case Alliance, and we're working with them, and we will be certainly, we're promoting it throughout the entire district. Go to our website to see where the mobile clinic will go, and for any community partners that want to have a pop-up clinic or a mobile clinic, give us a call. There's a form online. Visit our website, call us, discuss it with us, and we'll figure out the best way to get the people vaccinated where you're at. And Andrea, is there any other? Would you like to add to that?
I'll just add that the clinic on Tuesday at Case Alliance is from 9:30 till 12:30. It's open to anybody in the public who wishes to attend the clinic to receive their vaccine. We'll have both Moderna and Pfizer available. And as Dr. Chirico indicated, we really strongly encourage businesses and community organizations who wish to have a clinic at their location to reach out to us. Contact information is on our website. There's a request form on there, and we will get back to you as quickly as we can.
And as Mayor McDonald has stated, the goal is to reach 90% vaccination. I'm guessing that's full vaccination here in the health unit. Just to give residents a sense of what that means, if we do reach that 90% threshold, what happens next?
That's an excellent question, and that will really be determined by the province and the government to determine really how we're going to exit from step 3 and when that will occur. So that would be certainly a provincial decision, and hopefully we get enough people vaccinated, the impact of the 4th wave will be significantly reduced so that we can hopefully at some point soon get back to our new norm.
Thank you.
Hey, Dr. Chirico, Joey with Cogeco. So back to school's just around the corner, and I know a lot of the unvaccinated people are in the younger age ranges. Are there any plans to bring this mobile vaccine clinic to schools and get maybe some teenagers, high schools vaccinated?
Yes, absolutely. And we're working with the school boards right now, and that will be something that this bus will be perfectly fitted for. And I'll again call on Andrea if you have more details on that, but that's a good point, and that's exactly we're so thankful to have this that will help us do that.
Hi, using the bus to accommodate school-based clinics is absolutely high on our list of priorities. It allows us some flexibility in getting to the different schools and being able to provide vaccine to the students at those schools. So that's definitely part of our plan, and we are working with the school boards to determine dates and the plan for rolling it out to the different schools. And information will be going home to parents to let them know when we're going to be at schools and what the process will be for accessing vaccine through the clinics.
Good morning.
Good morning.
So, Dr. Chirico, who would be running this clinic? Will it be the nurses from the local hospitals?
No, it'll be our public health unit staff and any volunteers that we have relied on in the past that are certified to do this, but it's the health unit that will be running it, and we have a bus driver from this. You're not doing it, right? That will be working with us. We have the bus until the end of January 2022, which is phenomenal to be able to use it for that.
Okay. And is there any consideration why we weren't using nurses because of the conditions in hospitals recently? I know last week the nursing union came down and talked about how working conditions are getting difficult for them. Was that on your mind for choosing your local people for the bus?
No, we've had tremendous support from not just our own health unit nurses could not have done this alone. We got help from so many different, from people, EMS, primary care, the pharmacies, nurses from the hospital, nurses, retired nurses. We had tremendous support from many people, and we continue to rely on that support to get vaccinations done moving forward. Did anybody want to add anything to that? You gave vaccine. This is a perfect example. Our chair of the board, Nancy Jacko, retired nurse, worked at the hospital administration. She was giving vaccines, and she got trained in the COVAX system, and so we've relied on so many people to do this.
Perfect. So that completes the in-person questions. We'll now invite Catherine to come on and ask any of the questions that were submitted online.
Good morning. Our first question comes from Sarah Bissonette at the North Star. This week there have been cases connected to an outbreak. Two questions. One, in which health unit or health units is the original outbreak? And number two, are any of the cases linked to close contact connected to cases linked to that outbreak?
I will pass it along to Dr. Zimbalatti or Shannon.
Thank you. So we have had cases related to an outbreak. However, we wouldn't disclose the source of that outbreak as it might potentially identify any cases, and we do work carefully to maintain confidentiality of any cases. So we won't be able to disclose any further information on that.
Thank you. Our next four questions are in relation to vaccine passports. Our first, I'll read through all the questions, and perhaps Dr. Chirico, you can talk on this. The first question comes from Eric Thompson from the Tribune. If the province continues to show little interest in a vaccine passport, despite a strong uptick in vaccination in BC following the announcement of theirs, with the health unit explore issuing its own, similar to what Dr. Rumeliadis of the Eastern Ontario Health Unit suggested earlier this week? Our next question is from Mo Fahim from My Parry Sound Now. There's been some rumors of Ontario's medical officers of health considering individual vaccine passports if the province does not go ahead with them. What is the health unit's stance on vaccine passports? And number 3 and number 4 are from Jamie at CTV. With the provincial government still not rolling vaccine passports, what are your thoughts on a regional vaccine passport? Are you in favor of this? And what kind of effect do you think a regional vaccine passport will have if one is implemented?
Yes, thank you for those questions, and they're very similar to what I said before. Yes, certainly in favor of them. It's an added protection, and if the province decides not to, then, and currently it is under discussion with a regional or provincial approach among the medical officers of health, and certainly that is something that we are considering and would be in favor of doing if the province does not move forward with this, which I hope that they certainly will. What we want to try to avoid, again, is that a patchwork approach, and we want it to be consistent throughout the districts. And so that will take some coordination to do that. And as well, security remains an issue.
Thank you. That was all for the questions submitted online. We thank everyone for joining us. The recording of this press conference will be posted on our website as well. Thank you everyone for joining.
Thank you. And so now, if you would like, we can arrange to have you go through the bus. And Lara will take one at a time. Can we just ask that you wear your mask? Thank you.